Did you know that millions of people around the world are unknowingly making life-threatening mistakes with their blood pressure medication? If you're hypertensive, you might be one of them. And those mistakes could be putting your health at serious risk. Hey guys, how's everything going? Today, I want to talk to you about the most common and dangerous mistakes made by patients with high blood pressure. These are mistakes that could end up ruining your treatment, putting your heart and even your life at risk. So, if you're hypertensive, stick with me until the end of this video and learn how to avoid these pitfalls and take better care of your health. Hello health friends, how are you doing? I'm Dr. Williams, cardiologist and pacemaker specialist. We all know that high blood pressure is the #1 risk factor for cardiovascular disease. To give you an idea, hypertension is responsible for more than 10 million deaths globally each year. And why does high blood pressure cause so many deaths? Because it is the primary risk factor for atherosclerosis. What is atherosclerosis? It's the buildup of fat in our arteries. Since we were born, fat has gradually accumulated in all the arteries of our body, including the arteries of the heart. High blood pressure accelerates this fat accumulation process in all our arteries, making it the main risk factor for heart attacks. We know that a heart attack happens when there's a complete blockage of the heart arteries. So, if your blood pressure is consistently over 140 mmHg for systolic or 90 mmHg for diastolic, I strongly advise you to seek a good cardiologist, get a hypertension diagnosis, and start medication if needed. Now, let's talk about the main mistakes patients make in the office. What are the most common mistakes? I'm going to share some of them here for you, things that I routinely see in my practice. Mistake number 1. Checking the blood pressure and stopping the medication when it's normal. This is a huge mistake. For example, if it's 8 a.m. and it's time to take the blood pressure medication, the patient checks their pressure and it's 110/70ths. They think, my pressure is normal. I don't need the medication today. So they skip the medication, and a few hours later, their blood pressure goes up to 160/90ths. They don't check it again, don't realize it, and only take the medication the next day. But since the medication from the previous day is no longer working, the blood pressure stays high throughout the day. Here's the key. Even when your blood pressure is normal, take your medication on time. The medication is there to keep your blood pressure controlled throughout the day. So don't skip your medication just because your pressure seems fine. The medication is for continuous control. Mistake number 2. Patients who have had a heart attack and think they need antihypertensive medication. After a heart attack, many patients need medications that also help control high blood pressure. These medications, like ACE inhibitors and beta blockers, protect the heart muscle after an infarction. Even if you're not hypertensive, your doctor might prescribe these medications to protect your heart. So, if you've had a heart attack, don't stop taking your prescribed medications just because you don't have high blood pressure. Those medications are meant to prevent further damage to your heart, not just lower your blood pressure. Mistake number 3. Self-medication. I see this happen all too often. Someone experiences high blood pressure, buys medication over the counter, or takes their family member's meds. This is completely wrong. If your blood pressure is dangerously high, you need to seek medical help immediately, not self-medicate. Never take someone else's medication. Each case is unique, and you should always take the medications prescribed by your doctor specifically for your condition. For example, if your blood pressure is 180/100ths, this is a medical emergency and you need professional evaluation. Mistake number 4. Taking medications without knowing their side effects. Some patients take medications like ACE inhibitors, such as captopril, without understanding how they can affect their kidney function, especially if they have high potassium levels. If you're not aware of your potassium or creatinine levels and take these medications, it could lead to dangerous side effects like arrhythmias or even kidney failure. Medications such as thiazide diuretics can also cause issues like worsening blood sugar levels or gout. Some medications may also affect cholesterol levels. Always consult your doctor before taking any medication. Mistake number 5. Not following medical advice properly. The most common mistake I see is patients not adhering to their prescribed treatment. It's crucial to follow the plan set by your cardiologist and never skip doses. Treatment for hypertension requires consistency, and the benefits come when you strictly follow the prescribed regimen. If you recognize any of these mistakes, or if you haven't been properly diagnosed with high blood pressure, it's time to visit a good cardiologist. Untreated hypertension can cause serious harm to your health. But with proper treatment, you can live a long, healthy life just like anyone else. Did you find this video helpful? Don't forget to subscribe to the channel, give it a like, and hit the notification bell to stay updated. Share this video with your friends because raising awareness about hypertension can save lives. Stay tuned for upcoming videos where I'll share more tips on managing high blood pressure, high cholesterol, diabetes, and other heart disease risk factors. Alright guys, so for all of you who are hypertensive, stop making these mistakes. Follow the next videos for more advice and tips on managing your health. Take care and see you next time.